Hello, everyone. It's Friday, October the 15th. There's no other way to say this and everything, but we do have some reconciliation deaths, but we've got 110 more folks in West Virginia have died. And, we're getting through this, but it's really tough. And I want you to surely know that as tough as it is for all those that are out there, especially the health workers and all the great people that are doing great work at the hospitals or wherever it may be, or it may be, you may even think, well, it's tough. It's tough sitting here having to read all these names and all this kind of stuff, but at the end of the day, that's nothing compared to what these families are going through. So please keep them in your prayers, and don't let these people just become a number. The 3,999th death is a 74-year-old male from Logan County. The 4,000th death in West Virginia, 4,000 people. Gosh, it's unbelievable. Is a 40-year-old female from Greenbrier County. The 4,001st death is a 77-year-old male from Marion County. The 4,002nd death, a 74-year-old male from Harrison County. The 4,003rd death, a 71-year-old female from Kanawha County. The 4,004th death, a 48-year-old female from Mineral County. The 4,005th death, a 63-year-old male from Raleigh County. The 4,006th death, an 89-year-old male from Roane County. The 4,007th death, an 84-year-old female from Harrison County. The 4,008th death, a 67-year-old male from Wayne County. The 4,009th death, a 79-year-old male from Preston County. The 4,010th death, a 53-year-old male from Hancock County. The 4,011th death, a 73-year-old female from Randolph County. The 4,012th death, a 57-year-old male from Kanawha County. The 4,013th death, a 60-year-old male from Cabell County. The 4,014th death, a 91-year-old male from Hancock County. The 4,015th death, a 41-year-old female from Greenbrier County. That's a 40 and a 41-year-old in Greenbrier County that we lost. The 4,016th death, a 53-year-old male from Monongahela County. The 4,017th death, a 73-year-old male from Marion County. The 4,018th death, a 79-year-old female from Harrison County. The 4,019th death, a 75-year-old male from Kanawha County. The 4,020th death, a 53-year-old male from Mingo County. The 4,021st death, a 66-year-old male from Wood County. The 4,022nd death, an 85-year-old male from Greenbrier County. 4,023rd death, a 51-year-old male from Pendleton County. The 4,024th death, a 68-year-old male from Pendleton County. The 4,025th death, a 66-year-old male from Mingo County. The 4,026th death, a 63-year-old male from Fayette County. The 4,027th death, a 68-year-old male from Hancock County. The 4,028th death, a 72-year-old male from Monongahela County. The 4,029th death, a 64-year-old female from Pleasants County. The 4,030th death, a 60-year-old male from Lewis County. The 4,031st death, a 41-year-old male from Kanawha County. Another awfully young person. The 4,032nd death, a 70-year-old male from Lewis County. The 4,033rd death, an 84-year-old female from Mingo County. 4,034th death, a 73-year-old female from Mingo County. The 4,035th death, a 51-year-old male from Mineral County. The 4,036th death, a 39-year-old male from Monongahela County. The 4,037th death, a 66-year-old male from Preston County. The 4,038th death, a 57-year-old female from Marion County. The 4,039th death, a 96-year-old female from Harrison County. The 4,040th death is a 59-year-old male from Preston County. The 4,041st death, and God bless her in every way, a 101-year-old female from Kanawha County. The 4,042nd death is an 80-year-old female from Jackson County. The 4,043rd death, and pay attention to these, a 43-year-old female from Summers County. The 4,044th death, a 38-year-old male from Randolph County. The 4,045th death, a 43-year-old female from Berkeley County. The 4,046th death, a 94-year-old male from Harrison County. And get this, everyone, a 4,047th death is a 25-year-old male from Cabell County. The 4,048th death is a 79-year-old female from Pleasants County. The 4,049th death is a 37-year-old male from Jackson County. The 4,050th death is a 69-year-old female from Raleigh County. The 4,051st death is a 52-year-old male from Raleigh County. The 4,052nd death is a 65-year-old male from Nicholas County. The 4,053rd death is an 88-year-old female from Raleigh County. The 4,054th death is a 72-year-old male from McDowell County. The 4,055th death is a 94-year-old female from Kanawha County. The 4,056th death is a 50-year-old female from Mingo County. The 4,057th death is an 81-year-old male from Taylor County. The 4,058th death, a 43-year-old female from Webster County. The 4,059th death, an 82-year-old female from Putnam County. The 4,060th death is a 90-year-old female from Marion County. The 4,061st death is a 68-year-old male from Randolph County. The 4,062nd death is an 80-year-old male from Harrison County. The 4,063rd death is an 88-year-old female from Berkeley County. The 4,064th death is a 79-year-old male from Lewis County. The 4,065th death is a 42-year-old male from Mingo County. The 4,066th death is a 64-year-old female from Putnam County. The 4,067th death is a 90-year-old female from Putnam County. The 4,068th death is a 59-year-old male from Monongahela County. The 4,069th death is a 70-year-old female from Kanawha County. The 4,070th death is a 96-year-old male from Kanawha County. The 4,071st death, is a 79-year-old male from Lincoln County. The 4,072nd death is a 50-year-old male from Jackson County. The 4,073rd death is a 45-year-old female from Wood County. The 4,074th death is a 72-year-old male from Brooke County. The 4,075th death is an 81-year-old male from Kanawha County. The 4,076th death is a 51-year-old male from Boone County. The 4,077th death in West Virginia is a 92-year-old male from Cabell County. There's 31 reconciliations that we have. The 4,078th death, a 61-year-old male from Greenbrier County. The 4,079th death, an 85-year-old male from Wetzel County. The 4,080th death, a 69-year-old male from Marion County. The 4,081st death is a 50-year-old male from Cabell County. The 4,082nd death is an 81-year-old male from Upshur County. The 4,083rd death is a 49-year-old male from Logan County. The 4,084th death is a 70-year-old male from Wetzel County. The 4,085th death is a 66-year-old female from Preston County. The 4,086th death is a 92-year-old female from Pleasants County. The 4,087th death is a 74-year-old female from Boone County. The 4,088th death is an 85-year-old male from Boone County. The 4,089th death is a 79-year-old female from Wyoming County. The 4,090th death is a 54-year-old male from Boone County. The 4,091st death is a 59-year-old female from Cabell County. The 4,092nd death is a 55-year-old female from Berkeley County. The 4,093rd death is a 63-year-old female from Raleigh County. The 4,094th death is a 75-year-old male from Berkeley County. The 4,095th death is a 66-year-old female from Mercer County. The 4,096th death is an 87-year-old male from Ohio County. The 4,097th death is a 92-year-old male from Gilmer County. The 4,098th death is a 59-year-old male from Fayette County. The 4,099th death is a 71-year-old female from Pocahontas County. The 4,100th death in West Virginia is an 87-year-old female from Raleigh County. The 4,101st death is an 83-year-old male from Mason County. The 4,102nd death is a 77-year-old female from Mercer County. The 4,103rd death is a 79-year-old male from Marion County. The 4,104th death is a 53-year-old male from Raleigh County. The 4,105th death is a 79-year-old female from Raleigh County. The 4,106th death is a 76-year-old male from Wetzel County. The 4,175th death is a 75-year-old, the 4,107th death is a 75-year-old male from Monongahela County. And the 4,108th death in West Virginia is a 60-year-old male from Mercer County. Hooray. Can you just imagine the years? You know, there's 110 folks right here. The average age was probably, let's just say it was 70. That's 7,700 years, I think. 7,700 years of gaining wisdom that is passed on to all of us. It's gone. It's gone. You know, this pandemic is really tough, but losing all these great West Virginians is terrible beyond belief. You know, I always pause, don't I? It seems like when someone is really young, because I think right off the get-go, for crying out loud, you know, these people are my children's age, and it's or they're close to it. It's really sad. Our active cases are still around 10,000 or 10,213. We had 1,321 or 71 new positive cases. That's up a little bit. Our daily positivity rate is at 7.92. That's down just a little bit. The cumulative rate's at 6.05. We got almost 250,000 people in West Virginia that have had this and recovered. Our hospitalizations are down a little bit more at 785, and the ICU units are down a little bit more at 227. And the folks that are on ventilators down a little bit more, maybe at 163. Still a lot of people. Currently, there are 50 outbreaks in our schools. That's down in 21 counties, and that's down. There's 541 people that are, kids that are confirmed that have this now. And like I said before, there's 2 counties that don't have a mask mandate. That's Pocahontas and Tucker. A little update real quick on the Clarksburg nursing home, the veterans nursing home there. You know, we've lost one person there, and that person evidently was pretty ill, and of the 12 residents who were infected, one of the persons who was under hospice care, prior to the infection, has died. There's 17 total residents there and 13 positive cases. There's, 5 staff that are positive, and we do have it contained to the very best of our abilities, and we have our National Guard's done a fabulous job of doing what we always say about running to the fire. These are our heroes, and we're trying to look after them in every way. Just reminders real quick, the antibodies will save your life, especially if you're 65 and older. If you've got any symptoms at all, I don't see how in the world you can wait. You can't wait. You got to go get tested. If you get tested and we find this early enough, we'll take care of it. I encourage everybody in big gatherings, especially if you're age 65 and above, and you've got any kind of compromising condition, whether it be diabetes, heart conditions, lung conditions, whatever it may be, you ought to really, really think really hard about wearing a mask if you're indoors in a big crowd of people. The booster shots, I've been through that over and over. They're available if you're 18 and above and you're fully vaccinated and you're 6 months out and you're Pfizer, you need to go get vaccinated and go right now. Any kind of information, if you've lost your card or anything like that, all the stuff's up on our hotline there, and you can go to that and seek any level of information. And there's phone numbers there, and if you need to talk to somebody, call them. We've given out 2,100 doses since the last briefing. It's not enough, but at the same time, it's 2,100 doses. We just got to keep at it. We're at 65.8% that have received one dose of 12 and older. We're at 81.3% of the 50 and older, 91.5% of the 65 and older. I just keep over and over and over saying the same thing. We listen to our wisdom. Well, if we're listening to our wisdom, 50 and older, 81% have been vaccinated. 65 and older, 91.5% have been vaccinated. If you're listening to our wisdom and you're a young person, you need to go get vaccinated. That's just plain all there is to it. Vaccine eligibility 12 and above. We need our parents and grandparents to help us get these people across the finish line. Our kids absolutely need to get vaccinated. Grand families, take advantage of this $150 voucher and all the stuff that that you can do. We are saving our wisdom, who are saving our future. Now just think about that just a second. But our grand families can really help us there. All the COVID vaccine info line is up there. As far as testing, it's all free. We thank Fruth, we thank Walgreens and everything, and take advantage of this. Take advantage of all these things if they can help us get through this. Flu season is right upon us. The flu vaccine you can take absolutely at the same time you take your COVID vaccine. You should be doing that. I've gotten my flu shot. Just got it about 10 days ago. The rental assistance program, like I said before, we're probably slightly above this now, but $47 million have gone out approximately of $200 million that we have. This is for renters. This is for landlords. Take advantage. Take advantage of this. Absolutely, it will help you. It will help you individually. It will help your businesses. But not only that, it puts more money in the hands of West Virginians that we can start moving through from a multiplier effect. You buy gasoline, you buy big gulps at the 7-Eleven. All of that becomes more and more and more employment, more goodness for West Virginia. Take advantage of this. If you're a renter or a landlord, check it out. The bill that I've got upstairs and everything that we're kind of waiting on now and everything is a bill that basically gives some level of definition and exemption. If you have a medical reason why you absolutely don't believe that you ought to be taking your vaccine, or you have a religious reason that are legitimate reasons, absolutely, then, I think we should follow the law, and that's all we're doing. It's what our U.S. military does, but we absolutely should be following the law, and this is just a clarification to that. At noon today, we're going to have a major, growth and prosperity announcement, and I'm going to be joined by several folks. The West Virginia legislature, I think our senators are going to join, and some or all of our Congress women or men are going to join, and and then there's a couple people, from the outside. But nevertheless, we're very, very, very proud of this announcement. We've worked really hard to get to this, and the last thing I'd say to you is I am issuing a proclamation ordering all West Virginia flags to go to half-staff tomorrow. So, Saturday, October the 16th at the Capitol Complex and in Ohio County to honor the distinguished life and service of West Virginia Senator in Opry, and I'm going to mispronounce this, but Klimpaw and everything. So please forgive me for the mispronunciation. But Senator Klimpaw was served in both the West Virginia House of Delegates and the West Virginia Senate. His memorial service will take place tomorrow in Ohio County. And, again, I offer up, that you'll please give your prayers. I'll sure promise mine and Kathy's, for this man that served our state in many ways. So thank you so much. That's all I've got right now.
Thank you, Governor. Dr. Clay Marsh, our coronavirus czar, and Secretary Bill Crouch with the DHHR are joining us today and are available for questions. Retired Major General Jim Hoyer and Dr. Aina Amjad had prior engagements today and will rejoin us on Monday. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you mentioned the vaccine exemption bill that's currently being debated in the House. I wanted to ask you if you could go a little bit into the background of that. I know you added it to your special session call on Tuesday. Could you talk about where the idea for this bill came from and who specifically did you work with in developing it? Thank you.
Well, Charles, the idea came from a lot of different directions. The idea comes from just simply this. I'm a real believer. I am a real believer in if you'll just be fair and just think, look at West Virginia's numbers. Look at West Virginia's health and look at our age and look where we're located. Look where we're located within a rock's throw of 2/3 of the population and everybody coming through here going anywhere and everywhere all the time. And look at our numbers. They're amazing. They could have been tragic beyond belief, and they're tragic enough. But they're amazing to what they could have been. Now, how'd we do it? How'd we do it? At the end of the day, I'll promise you how we did it is we stayed together. We stayed together. Even though there was times when we had to close stuff, and there's a lot of people probably not very happy about that, but they went right with us, didn't they? There was times when a lot of people have been vaccinated that they didn't think, well, maybe that they should be vaccinated. And there's times when we're losing people and we don't have people vaccinated and we absolutely could look back and say, dadgum, I wish to goodness that person would have gotten vaccinated and they should have gotten vaccinated and on and on. We have made the right moves. We've made the right moves all the way through this. The secret has been one thing, that whether we liked it or not liked it, we pulled the rope together. Now, we didn't try to ram something down each other's throat. We stayed back and we were absolutely respectful. So in that, there's been a lot of thought from my end, and absolutely with all this, I personally don't believe that really and truly we should just throw our freedoms and our rights in a trash can. We're going to get through this. I personally believe that really at the end of the day that someone that genuinely has a medical or religious objection to this, that someone is not going to be the catalyst that's going to cause more and more issues. And that someone should be at least not just terminated from their employment, because they believe in this strong enough. So at the end of the day, sure, I've met with a bunch of legislatures and everything, and I want to be respectful of them in every way, and I appreciate their guidance. I've talked with our medical team. I've talked with everybody. At the end of the day, for good or for bad, this is what I think, Charles. And I've got to do from time to time things that are really tough decisions. This is what I think. This is what our Constitution says. This is what the very thing that makes America as great as it may be, and West Virginia as great as it may be too. So with all that, you know, Charles, we would be here a long, long time talking about all the people that I've consulted with and thought about and everything in making this decision. So I think it's the right decision. I think it's a good decision. And at the end of the day, I do not think that absolutely this will be a catalyst that will cause us, you know, lots and lots and lots of problems. I hope and pray that we're at the point, because, I mean, Charles, you know and I know too, the greatest way to really just stop this or stop anything and everything is everybody just go to the house and batten down the hatches and nobody do anything. Well, we don't want to do that, do we? We're Americans. We don't want to do that. We're going to fight this thing. And if we're going to fight this thing, we're not going to give up our way of life. And so if we're not going to do that, we're going to have to deal with it. We're going to have to deal with it as we go forward. And that's what we're doing. We're dealing with it. We hate it like crazy. 4,108 deaths. But we're going to deal with it. We're going to deal with it from the standpoint of our Constitution and our freedoms. And we're going to deal with it the very best that we can possibly deal with it. That's all I got.
All right, thank you, Charles. Next, we'll go to Evan Bevins with Ogden Newspapers.
Thank you. I had a question for Dr. Marsh. Can you talk about if there's any research or knowledge of what might happen? You know, we've mentioned flu season. If people can be infected by COVID and the flu at the same time, and if that might exacerbate the condition, or is that unrealistic?
Dr. Marsh, please, sir.
Thank you, Evan. Thank you, Governor. Certainly having two respiratory viruses that could occur simultaneously would be concerning of seeing more severe consequences with breathing and oxygenation. We know that the Delta variant is a particularly strong variant that has caused more severe illness, particularly in people unvaccinated. And so the co-occurrence of the flu with the Delta variant of COVID-19 in somebody who doesn't have immunity related to vaccination or have other immunities would be concerning, which is the reason why we've been so, proactive in supporting vaccination for both COVID-19 and for influenza. And since last influenza season was much milder,
I'm sorry, we apologize for that audio issue, but thank you, Evan, for your question. Dr. Marsh, were you finished with the answer?
I was, Jordan. Thank you.
All right, thank you, Doctor, and thank you, Evan. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I wanted to ask Dr. Marsh if there's been any study as to why some people get sick, why some people don't get sick. If there's any family connections, I'll bring you into the loop a little bit on our situation. Our general manager at the radio station caught COVID and spent a long time in the hospital on a ventilator. Her son is currently in the hospital on a ventilator and not doing very well at all. And I got notification last week that her sister had to be hospitalized. Is there anything out there that would confirm that some families are more likely to get it than others? And maybe as an extrapolation of that, if there are some comorbidities that are worse to have than others if you're exposed to COVID. Thank you.
Dr. Marsh, please.
Thank you, and I'll try to be succinct with this. So there are some inherited abnormalities in immune function, particularly related to certain types of factors our bodies make, one called interferon gamma, that appears to be important in our ability to take care of COVID-19. What we know is that being fully vaccinated and having that immune function is really important in reducing severe illness. So that certainly is something that we look at in cases where COVID-19 is spreading through families. But the Delta variant is so much more infectious, existing, as we've said, in 1,000-fold greater concentrations in the droplets produced by people who are infected, which is a grand and increase in inoculum dosage. We do know that there are several comorbidities that are very much associated with more severe disease. The most important one is age. People over 60, 65 years old are at much higher risk of severe consequences of COVID-19. As far as comorbidities, the obesity appears to be the most important other comorbidity that is associated with more severe outcome from COVID-19. Thank you.
All right, thank you, Paul. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. Thank you for taking my question today. I would like to direct my question to Secretary Crouch. So the governor, he read about 100 deaths today. And I know, half of those or however many were reconciliation. But the governor has been reading a lot of deaths. The DHHR daily COVID death reports also show a lot of deaths. But on the dashboard, I'm not really seeing that reflected. And I just wanted a little bit more clarification. If you look at the dashboard, it seems like our deaths are going down in the past week or two. And when I talk to your staff about this, they always get back to me in a timely manner. And they said, deaths reported out on the daily dashboard are not people who died the previous day. These deaths can span over several days or weeks. And that just kind of makes me a little bit reluctant to cite the dashboard for single day deaths or the 7-day average. Any clarification would be great. Thank you.
June, before I pass the bill, there was 31 deaths of the 110 today that were reconciliations. I think that's right, but you're right. We've read a lot of reconciliations and surely a lot of deaths. But anyway, Bill, please go.
Yeah, thank you, Governor. Thank you, June. One of the things that can be confusing, June, is the deaths you're seeing daily on the dashboard are from the previous update. What the governor reports is from the previous press briefing. So that can be a little misleading if you're not careful to listen to what the governor's talking about. And some of the press briefings have been staggered and changed from Wednesday to Thursday. So sometimes there's different numbers there based upon different days of reporting. But the deaths, as Dr. Marsh talked about consistently, are going to continue for a while. We're through the peak of this surge, but we're not through this surge. This is going to take several more weeks, a month, 5 weeks. We're hoping it's as soon as possible, but deaths will continue and will start declining. But they're the last indicator that we see drop. They are the final indicator that we're really getting through this surge when they start dropping. We've actually plateaued a little bit in the last few days. We have, in terms of our cases and in terms of the individuals, if you look at hospitalizations in ICU and those on vents, we plateaued a little bit. So we suspect that will continue a little bit longer and then we'll start dropping again. So, but the days in terms of the death certificates they are not necessarily the previous day. These death certificates take time to get through the system. Again, physicians have to sign a death certificate and give a cause of death, and that's not always immediate. So we are now matching death certificates twice a week to make sure that we get those death certificates as soon as possible. So the governor separated those out to give folks a better idea of when those deaths occur, but we try to keep those as coming through the system as quickly as possible. I hope that helps you. Thank you.
Thank you, June. Governor, I'll turn it back to you.
Well, the only thing I could say, is that the chart that I have right here, and Jordan, I don't think you need to put that up, but the chart I have right here shows the number of deaths in the state of West Virginia, and I don't know exactly what time period this is from, but nevertheless, the net of the whole thing is just one thing, and that is 92.5% of the deaths in West Virginia are from folks that are unvaccinated. 7.5% are vaccinated. 92.5 are unvaccinated of the people that we've lost in West Virginia. If you'll just look at the graphic here, with the people that are in the shaded area here are all people that we've lost that are unvaccinated, and these down here in the white are vaccinated. The amount is staggering. We got to get you vaccinated. It is so important. Please, please consider it. Please get all the information you can possibly get, and remember just one thing, and this is all there is to it. If I had any other way, I would be telling you, any other way. The vaccines are really safe. I have no other bullet in the gun. That's the only way we're going to stop this. We read 110 names today. 110 great West Virginians. Like I said, we always remember the mine disasters or whatever it may be. How many mine disasters would it take to be one day of this? We got to stop it, and we have a choice. If you'll really help me, we'll really get across the finish line. But I thank you for all you're already doing. Be respectful of all, and we'll get there. Thank you so much.